You are listening to the Cultural Providers Network podcast, a Minnesota Association for Children's Mental Health production, building and sustaining a network of culturally and ethnically diverse voices to promote policies, practices, standards, and research that improve the mental health of children, their families, and communities.
This podcast is brought to you by the Minnesota Department of Health. Greetings, everyone, and welcome to the Cultural Providers Network podcast. I'm your host, Brandon Jones, and on today's episode, we have Dionne Trice, who is a therapist in the field, has been a therapist for a while. I don't even remember how long you've been a therapist. We've known each other for a little while, but you are a dynamic individual in the field, and we are so fortunate to hear your perspective on BIPOC folks in the field, on dealing with communities of color, and on the system that we work in. And we're going to talk about that in today's podcast. So, how are you doing today, Dionne?
I am doing really well. Thank you so much for having me be here. And I appreciate this opportunity to share my perspectives.
Absolutely. And we appreciate you being here to share that perspective. Now, can you introduce yourself? Give us your origin story. Who are you? Where are you from? Why are you doing this work? Like, tell us a little bit about yourself.
Okay. Well, as you said earlier, my name's Dionne Trice. I've been married for 38 years now, as of September 6th.
Hey, as long as you got the years right, that's all that matters, right?
That's all that counts. A mother of three, one child deceased. Um, and so I am a licensed marriage and family therapist. I work over at the Family Development Center over in St. Paul, Minnesota. I work with individuals 14 and older, and couples predominantly, specializing dealing in grief, and trauma. And so, why did I start doing this? Well, as I mentioned earlier, I have a son who is deceased. He died at 22 from cancer. Once he was diagnosed, he lived about 9 months after his diagnosis. Very aggressive. And when they gave us the diagnosis, they let us know that they had no way, any cure for his particular diagnosis. And so, in that span of time of trying to deal with the grief and the loss, we saw about four different therapists. Sought out four different, one African woman, two African American females, and I had one white female as a therapist. The first woman that my husband and I both went to for grief counseling, we didn't stay with her because it felt very perfunctory. The way we were greeted and the way we were treated was kind of very distant. And when you're dealing with really intimate pain like that, it's important that you be able to feel like you can bond and connect with your therapist. And so I know that there are certain styles and forms of therapy that can be kind of that can appear very standoffish or very um, distant. That was not the type of therapy we needed at the moment. And we both walked out of the door after that initial session and went, no, that's not going to work for us. Went to another woman. And that also was another kind of those situations of that sometimes that shield of professionality or professionalism can be a turnoff for folks when they come in because we
Yeah.
feel disconnected
Yep,
from them and
absolutely.
they don't feel like they're really meeting with a real person. So that was it. The person that I stuck with for the majority of the time was a white woman, and in talking about issues around race and all the rest of that, I'm very vocal and very direct. And so it's one of the things that when clients do their 30-minute consultations with me, I let them know that that is who I am. I work very hard to be very transparent. And I think part of that is because I work from a experiential lens. I really believe in the fact that as a therapist, part of the therapy is who I am, right? So I try to give them an experience of who I am. so that they'll understand who they're connecting with. And like, if I am not the person for you, that's okay.
Right.
If my style does not work, if I'm not asking the kind of questions you want to have asked to draw you into the communication, then let me know.
Right.
Right, because this is your time. Talk to me about
Yep.
this, and I want to be here for you in your time. And so with my particular therapist, when I asked her, I was like, it's gonna be different having a white woman as my therapist. So
Mm-hmm.
what's
Mm-hmm.
that like? How many people of color have you worked with?
Right.
What's that like? And so she told me, and then I asked her again. Um, she asked me actually. She said, "Do you think there'll be any problems with us as I'm a white woman and you're a black woman, and all and your experience?" And I said, "Well, these are the things I'm concerned you might assume or think about me.
Mm-hmm.
And we need to talk about that."
Mm-hmm.
And her next question to me was, "Well, if I do something, would you tell me?" And I'm
Mm-hmm.
like, "Yeah, I'll
Mm-hmm.
tell." And
Yep.
can you handle it if I tell you? She's like, okay, well, we'll work it out. Whatever it is,
Yeah.
we'll figure it out. We'll work it out together. And so we did a really good and great amount of work. And then she told me, you'd make a great therapist.
Mm.
Even though I had already been working for 20 years dealing with domestic violence, right?
Mm-hmm.
And I've been a youth pastor in Chicago and Milwaukee and a couple other places, some rural areas as well. Had already done some work in that field in those ways. And so she told me, she said, well, when you decide, if you decide that's what you want to do, you can always get back in contact with me. And I'd be more than willing to be a mentor, even if you wanted me to.
Right. Wow.
And so it's funny because as I went to get my degree, she was my instructor in dealing with grief and loss.
Wow.
So that's that. And then I had as a family, we had therapy with the African American woman, Kay Ann Mason. Love her very much.
Yeah.
I don't
Oh,
have any
yeah. I
problems
know
with giving
Can.
her that shout out.
Yeah.
Um, but she is also someone who has become later in life a mentor in my life as well.
Yeah. Absolutely. Absolutely. Yeah. Kan's a rock star. I'm definitely trying to get her on the podcast. She's so busy though. Yeah. I did reach out to her. So we'll see if we get her on. So my next question for you, you kind of walked right up to it a little bit. Your therapist that you were working with, the white therapist that you mentioned, you said that, she asked yourself some questions just to see how comfortable the two of you can get and being able to move forward together through your therapeutic journey. So the question I want to ask you is, how do you kind of integrate cultural sensitivity and awareness into your practice, especially when you're working with various different clients of color?
Again, there's that directness of closed mouth don't get fed, right? And so,
Mm-hmm.
as my
Mm-hmm.
grandmothers always say, and so ask the question. The thing about therapy is always being led with curiosity. So part of that is asking the direct question. So, hey, I'm a woman of color, I'm a black woman. And I ask this with my white clients as well. I'm a woman of color. How does this feel to be able to say that to a person of color? How does that feel? Do you feel like there may be any hindrances that will come up? Or many misunderstandings or things that you would worry or be concerned about because I am a person of color, because you are a person of color that you feel we need to talk about. If I'm speaking with somebody who's like, I've got a black client and, well, how do you think that being black impacts whatever is going on? Or how you're feeling about it, or how you're thinking about it. So, there's a very intentional and purposeful ask.
Yeah, that's that's amazing. I think with that ask comes, kind of a level of encouragement for folks to speak up,
Mhm.
especially if they feel uncomfortable. And honestly, sometimes it's even some permission
Yes.
to advocate for yourself, which I think is a huge barrier for a lot of folks of color who go into therapy. Is like we don't often know what we should say, can say, or shouldn't say because of a lot of the pain we've gone through and a lot of the systems that we've been involved in, the responses and how that a lot of times takes away from community. So it can be a tricky space to kind of navigate for folks when they initially come in.
I will say one other thing, which is um, always I lay out where I'm at, right?
Hmm.
As a therapist, it takes this real amount of vulnerability to be able to say, hey, because especially some of the questions we ask on our intakes, like substance use and all this other
Right.
kind of stuff. And so I just explained to this is why I'm asking this question. This is what this is about. This is where this information goes or doesn't go. If you're concerned about anything that I'm writing down, ask me a question. I'll tell you what it is. I'm here to make you comfortable and let you know, inform you about everything that's going on so that you feel like it's okay.
Mm-hmm. Mm-hmm.
Right.
Amazing. So speaking of that, one of the things that a lot of people go through when they first enter into a counseling dynamic is the intersectionality of identities that show up. And as a clinician, you have to kind of hold people and their perspectives, but also keep it in the back of your head. Okay, where's this coming from? How did they develop this worldview, or how did they develop these things? So, in your experience, how have things like ethnicity, race, gender, sexuality, class, how have these kind of shown up from a therapeutic space?
Wow. I think so. Let's stick with race as where
Okay.
we're starting at. Okay.
Yep.
Um, when I am looking at like the levels of stress
Mm-hmm.
that a person is encountering, when I am looking at the way that they are conceptualizing their experience,
Mm-hmm.
right? And trying to figure out the context that that's coming from and helping them to recognize the context that that is coming from, right? So whether this is coming out of the context of how you were raised, this is coming out of a cultural context in which society has placed on you to think, believe, because this is another thing that happens when we're working with couples about like maleness, femininity, masculinity, roles within the relationship, communication, all that stuff. It shows up in all these different ideals, right?
Mm-hmm.
Where did you learn to be a man from? Where did you learn how to deal with women from? Right? Because all of those are also subcultures. So we have to consider those
Mm-hmm.
things and they change also when we're talking about racial areas or when we're talking about gender, when we're talking about sexuality, right?
Mm-hmm.
So again, asking the questions of the client of how this came up for them. Where did they first learn? What did they first understand? Who were their teachers around this kinds of things? And the more information I get from them and them telling their story, they start having these aha moments of like, yeah, that's right. I got this from so and so. Yep, I
Mm-hmm.
learned that. I learned that from all the dudes on the block. I learned that from my uncles and watching how their
Mm-hmm.
relationships went, right? And so just work encouraging curiosity and encouraging critical thinking
Yeah. Yeah.
about what's happened or what you believe to be true. Because some stuff we just accepted it
Yep.
just because it was, right? And
Yep.
everybody around us is full of trauma. So we just assumed
Yep.
that trauma was right,
Yep. Yep. Yeah.
So
No, absolutely. I mean, you're talking about something that a lot of my work tries to undo is instead of critical thinking, the thing that I try to challenge people to do, and I did this when I was practicing clinically as well, is think more abstractly. Like
mm,
have multiple perspectives to inform if your perspective is one correct, might need some tweaking, or you might be completely wrong, or maybe you just haven't thought about it enough in order for you to make some different choices for yourself. And I think and that for me comes from my school of psychology, which is Adlerian,
mhm,
which really focuses on perspective changing of people. It's not your behavior is good or bad. It's what's behind that and what are you going to do about it. Like that's kind of my always been my approach. And I think that has worked pretty well with BIPOC folks because you're right. Sometimes we're going, especially black folks,
mhm,
sometimes we're going up against generational mindsets. Like it's not
mhm.
even habit, it's like straight culture. And when
Yes.
you have an alternative narrative to culture, you look like something's wrong with you. And we'll say that like,
Oh yeah.
like what are you talking about?
Oh yeah.
As a therapist, that can be a very uncomfortable space for folks to be in because you do have a level of authority when you're in that therapeutic dynamic and that challenge that may show up. I think that's why a lot of therapists kind of back out or they refer out when they are dealing with folks of color because it gets so uncomfortable that they don't know what to do with it. And sometimes the challenge is good. That verbal back and forth or even that further understanding can help really enhance the therapeutic relationship. But a lot of therapists that at least that I've come across, they get uncomfortable and they're like, "All right, it's time for me to check out or find somebody else for this person." Yeah.
Yeah, I mean, the thing is that the wonderful thing that I do like is about the mode of therapy that uses that I don't come from an expert. I don't have
Yep.
to be the expert in your life. You are the
Yep.
expert in your life.
Yep.
And so one of the things that I hear a lot of times, especially when we get so stuck, right? That thing of, I don't know. So I'm like, so how's that work? I don't know. And so many times I tell my clients, well, when you tell me I don't know, you told me three things. One of three things. One, I don't know is because the fact you haven't sat down with yourself to find out. Right. Two, you do know, but you don't like the answer that you got from the inside. Right? You do know,
Yeah.
but you don't like that answer that you got on the inside. So you want to pretend like you don't know, because that's the best way to bury it. And three, you know, but you don't want to tell me.
Yeah.
So here's the deal. You can let me know which one it is. And if you say you don't want to tell me, that means that we haven't built that kind of a comfort yet. And that's cool. You don't feel comfortable enough to tell me that yet. We can work around it. We can go on to the next. Right.
Yeah.
So yeah, that's part of what my whole dealing with
Yeah.
whoever I'm dealing with in front of me.
Awesome, awesome. Yeah, that the rapport building piece is critical. I
Mhm,
think working with anybody, but especially from communities that have been system involved and have cultural narratives about how systems negatively impact your life, you have to build what I call compassion and accountability, like understanding what people have gone through, but at the same time, you have a job to do. They're required to come to you, or
mhm.
they have things that they need to meet in order to move forward, and you have to hold that space as well. Which
Yeah.
which actually brings me to my next question. So, what role do you believe mental health providers play in addressing systematic issues? So, things like racism or discrimination, or even sometimes intergenerational trauma. What role do providers play in assisting communities of color with those types of issues?
Hmm. I think it's interesting that we have to even ask that kind of a question,
Yeah, I know.
right?
Yeah.
Because if we don't ask what role do providers have to play if someone has sexual dysfunction in a relationship? We don't ask what role does a provider play when people are having issues around pornography, when people are having issues around their finances because they can't communicate about their finances in a couple. We don't ask those kind of questions. What does a provider have to do with abuse? We don't ask that kind of question, right? And so this is still trauma. Racial trauma is still abuse, right? However you get done, it is an abuse of one cultural system against a whole set of people. So it's still abuse. So I'm always confused with what's the role. It's the same role. Curiosity. It's the same role of trying to work to help and equip people on how to deal with everyday issues, to be able to deal with variance, to be able to have stress tolerance, to be able to communicate clearly, to be able to advocate and set their own boundaries, to be able to understand who they are and their own identity to develop it according to who they are and what suits them best. So, yeah, our job is the same in all of those same things.
Man, that was dynamic. I'm glad you went there. I've asked this question now to several providers on the podcast. Everybody's giving a different answer, but no one said that. Like, if you have to even ask the question, it's pointing to the issue and the concern. So why
Mhm.
are we still here? And why are we not asking it for all the other issues that show up, in our therapeutic dynamics that we find ourselves in?
Well,
Um,
that's part of our identity, right? Your your
right,
your race and culture is part of your identity.
right.
And we're talking about identity development here. We're
Hmm.
talking about the way that identity impacts everything else that impacts you in the rest of your life. So why would that not be part of the conversation?
Hmm. Right. Exactly. Great answer. Great answer. It leads to my next question. How do you navigate discussions around resiliency and strength within communities of color while also acknowledging the impact that systematic oppression and trauma have had?
One of the things that continuously come to my mind is I think about um, some of my Black clients who have been raised in suburban areas or raised by white families, right? And so their engagement with Black culture has either been none or it's been negative. Because again, you're not Black enough because your Black card getting revoked for whatever. I don't know what your Black card getting revoked for this week, but something, right? And so that impacts their development of their identity. That impacts how comfortable they feel in their own skin. And yeah, folks come in the office and they're upset and they're mad because why haven't other Black women accepted me or my experience with other Black people? And so one of the first things we work on is like, what does that mean about being Black? What is Blackness? Since we're not a monolith, it's a lot of things, right? If
Absolutely.
a Black person has been adopted, then that automatically becomes part of the Black experience because it's a Black person doing it, right? If it's skiing, then it's a Black person doing it, so it's part of the Black experience now. So the fact that whatever you went through as a person in Black skin, it's part of the Black experience, and that simply in and of itself makes you Black enough, right? So
Absolutely.
that whole thing of trying to release, I always talk about decolonizing our thinking.
Mm-hmm.
Right. And this idea that we do not have to, I know through socialization and through racism and all these other institutes, we've been forced to have to constantly think about our own safety in every setting, wherever we're at, right? And that is stressful. Again, it impacts our health, it impacts so many other things about us as far as health and well-being and financially, all the rest of that, right? But and so the ideal of I don't have to explain my existence to others is very revolutionary,
Mm-hmm.
right? I don't have to disprove the myths and tropes about Black people because I can't speak for all Black people. I can just speak for me.
Right.
And you just get to be you today in this system, and you get to exist, and you have every right. You don't have to define yourself, you don't have to explain yourself, you don't have to apologize for being who you are, where you are, when you are. You just get to be,
Yeah.
right? And so I think that is one of the biggest things that I've been able to offer in the work with our clients.
Mm-hmm. Yeah, and and one of the things that I've noticed is we've seen an uptick in people pursuing therapy or other therapeutic interventions, especially since the pandemic, where it was like something rang a bell rang and everybody said like, "Oh, I should probably take care of myself and talk to a professional." And you know what? The mental health field, we've been asking for that moment for years, and we finally got it, and we were not ready. What did we learn? We learned that people want our help, but we need to help ourselves too. Because a lot of therapists checked out during this time, which is also part of this whole wait list phenomenon that we see across the country.
Yeah.
Is a lot of people are like, I can't do this job anymore. Um, but the work still continues, and we still have to find innovative ways to serve and to help people through their dynamics. But one thing has kind of still, even though we've seen an uptick, one thing that still comes up, and the question still comes up, and I'm going to ask you, is around stigma and people not being willing to engage in therapeutic support. So, what advice would you offer to, I'll use the term BIPOC people, BIPOC folks, or individuals who may be hesitant to seek out therapy or face barriers in accessing mental health supports?
Like you said earlier, this time is about taking care of you.
Hmm.
If you don't take care of you, you go out and you engage with people in the community, at your job, at work, um, in your home, and then that impacts that, and that gets messy. And the more messy that gets out, the more that ripples out, um, it causes a whole impact on us as a community, as a country. This thing is more than just you. I know a lot of times we think we're strong enough and we can suffer alone and it don't make a difference to anybody else, but it does. It makes a difference to all of us, even to us who don't know you personally. because we know there's not that many degrees of separation between us. So sooner or later, you not getting help is somehow or another going to impact me one way or another. As far as the stigmas, it is, yes, there are barriers, there are problems, the finances, the insurance payments, co-insurance, co-payments, all the rest of that kind of stuff. Look and see if there's a sliding scale fee or some other kind of way that you can be able to get services. It is not, talk to the person that you're looking for as a therapist, talk with them and find out who they are, what they're about, understanding what these privacy notices mean for you, because of the fact that they're there for your protection. And trying to get a better understanding of what this is about. Dealing with your mental health is not about something being a problem per se, or that you're broken, right? It is about being the best you can be. And everybody needs help sometimes on something. Therapists need help, so it's important, because I'm also the director of our teaching clinic at the agency. So I work with the interns and the externs, always emphasizing even to them to also make sure that you find a therapist and that you're having someone. So because that type of secondary trauma is real.
Yeah, absolutely.
Yeah.
Absolutely. So speaking of the professionals and the field, I want to ask you a field question. I want you to put your no, I want you to look into the globe and do some futuristic planning.
Oh,
And my question for you is, what changes or improvements would you like to see in the mental health field to better support BIPOC communities? Um, and I want to add a little piece to this question. Both support people of color who are clients and people of color who are actual professionals. If you can think about both of those groups, what, improvements or changes would you like to see for this field to serve both groups better?
well, of course, better coverage is the first thing that I think of, right?
Yeah.
Better opening and finding better ways to be able to have access
Yeah.
to mental health services. I think also in working with white clinicians, because that number is not going to change. That ratio
Right.
of the population to those who are in the field are not going to change anytime soon,
Right.
right? It would take a big deal of recruiting. So that's another piece in the field, recruiting people of color to be into this field, and also supplementing them and being, because a master's degree is not cheap. So,
Not at all.
so being able to have stuff like that supports those types of things and grants, and not just after we already get the license. I'm talking about
Right.
before
Yep.
in the whole process of it. Um, so training white therapists and knowing how to be culturally responsive. We say those words, but I don't think we really have a meaning definition assigned to what that actually means, to be culturally responsive. And so when I say that, I mean the fact that you have a curiosity and openness to learn. You've done some learning for yourself, or informing yourself about things, and then a willingness to ask the question even if you're wrong. And so if you are humble and you don't think you already know, then when you ask the question and you don't get the answer you were expecting, then you go with what you got, right? You don't try to force people to fit into these ideals and concepts about what you think people are like or what you think it means just because I have a title of a certain thing. I'm gonna say something that's gonna be a little off script, off point.
Yep. Go
Um,
for it.
but my husband and I, we would do racial sensitivity conversations, and we were doing it with this particular group up in Duluth of progressive white women. And so I was asked, is it okay to call you Black? And I go, well, you can call me Black, you can call me Negro, you can call me colored. Don't do the ER or the A.
Yeah.
That's not gonna go good for you. So don't do don't do any of those. But other than that, you can call me whatever. I said, but here's the problem that I find. I said, I'm confused about what your struggle is in this, because if me and you were standing on the curb, a white van came by, opened up, they put a bag over my head, grabbed me, threw me in the car, and drove off. You call the police came and they said, give me a description of the woman that was taken. And you go, she's a short woman, a little overweight, and she has a great smile and personality. The police are not going to find me. I'm dead. So please say you found a black woman, you found a whatever. I said, because that is a descriptor. That is all that tells you that it
Yeah.
knows that you know about me. You have that description of my melanin content. But if you think you know anything else about me, you understand anything else about my life experience, who I am or what I think, then you are sadly mistaken. And that is where we have a problem.
Right. Right.
Right.
Hmm.
So this thing where we're talking about culturally competent therapists, culturally responsive therapists who are not people of color, that my color doesn't institute any kind of knowledge or understanding about anything that I am. You learn that from relationship with me. And so we need more therapists who understand that, so that when people come in and they're seeking help, that they can feel comfortable and they can feel accepted in the space and want to stay. And when people have that, one of the reasons why I have a waiting list is just because we have so many people, but also is because the clients that I have also go out and speak about me to others and
Yeah.
their experience with me. And that causes people to want to come in and do, hey, I don't know, but I went to a therapist. I told my uncle about it and he was like, yeah, I think I would want to go. So those are some of the things that would help us get more people in. So yeah, as far as that, I would love for us to have more culturally responsive white therapists, engaging and supporting and recruiting more of people of color at the school, high school level, college level, whatever, supporting those, and then finding better ways for there to be access in the system. And also, if insurance companies would pay us properly, okay. So I don't know if they
Yeah.
watched my
No, absolutely.
podcast.
Not only the insurance companies, I think that legislation also needs to look at the importance of payments around mental health, and we have
Mhm.
to have some dollars, not just put towards crisis. I think crisis gets a
Yes.
lot of the attention, which it deserves, right? We want people to be alive and safe, but there's also these other huge needs that can sometimes even prevent some of those other things from
Yes.
happening if we invested upstream a little bit more. And
Yes.
I just think that I think for some fields like politics, this mental health conversation is newer, not new, but newer, and they're playing catch up. And I
Yes.
think our field is also playing catch. Like we're all behind where we
Mhm.
are, and society's rolling, right? Society's moving forward, and we all have a little bit of refresh and updating that we need. And unfortunately, I think some of the this mental health crisis we're having with young people is helping that, but it shouldn't have to take that. It shouldn't have to
Yes.
take the threat of, our next 2 to 3 generations being in this crisis state of mental and emotional health for us to get to where we need to be. But that's what it is, unfortunately. It's just
Well,
our reality.
that's because we're always in a reactive state,
Yeah, go
right?
for it. Yeah,
Rather than a responsive state. We're reactive to everything. And like you said, if we would do a little bit more of this work upstream, then we wouldn't get to the crisis mode, right?
yeah, absolutely. Absolutely. All right, 2 more questions, and then we're gonna close out our conversation for today. My next question is there anything that you would like to share with our audience about either your journey as as a mental health professional, or your perspective on the importance of just cultural competency or cultural responsiveness in this field of therapy?
I think when I said earlier, we say those words, cultural responsiveness, cultural competence, but they have no real definition. And so we need to, as a field, we need to actually define what that really means, right? Because it doesn't help our white therapists or our therapists of color, because then we're not really knowing what that is expected of us and how we should show up in that way.
Yeah.
Conversations and the way we teach um, around cultures, rather than them being a report and a study in that way, that needs to change. These conversations around race need to be had in the classroom as we are learning, because they are poorly done. the staff doesn't know how to have these conversations. And so then you have students of color in these rooms when these microaggressions and macroaggressions happen that feel unsupported. They drop out of the program. They don't know how to deal with the stress of it because the things that they're teaching the teachers, the instructors, professors, as they are teaching these theories have not included ways that this engages with people of color so that we have real practical ways about how we do this. So you can really know because really most of our therapists are left floundering out there on how to even apply this
Yep.
in a real way, right? I think part of the fact of doing the work that I did in community advocacy and working with my husband, who's a lobbyist and who works in community an engagement person, having worked alongside him in that way, and then coming from a ministry background as a youth pastor and all the rest of those kind of things, you kind of have to get your social advocacy chops worked up early and that kind of stuff. And so then bringing that experience back with me as a therapist, then that also is engaged in the way that I engage and work not only with my clients but also with our agency. Because our agency, one of our policies or one of our practices, focuses of practice, is training um, therapists of color and training white therapists in cultural responsiveness. And so we're working on undoing whiteness for our white therapists and decolonization of our own mental health and our own mentality as far as therapists of color. And when I first came to the agency, there on a good day there was 3 of us, and now there's 14 of us who have grown and have stayed.
Wow.
And so I think that has been a big part of the work that we've been doing, and directly working around race and
Yep.
ethnicity and
Yep.
what that means.
Amazing. My final question for you is if anyone listening to this podcast wants to learn more about you or connect with you, is there any specific place you want to point them to connect with you?
Okay, well, they can find information from me on my profile on Psychology Today. They can find information from our website, thefamilydevelopmentcenter.com. They can find a profile of all of our therapists that are there, myself. And they can also email me at Dionne, Dionne, at thefamilydevelopmentcenter.com.
Perfect. Dion, thank you for this amazing, amazing podcast interview. I look forward to connecting with you on other projects and stuff. I have some ideas just based on our conversation. So we will be connected. And yeah, thank you again for your time.
Thank you very much. I appreciate it.
Absolutely. Take care.